Here we will see how we can register or record the patient's treatment into the hospital. Suppose we got an outpatient into the hospital right now, which is John D'Souza. So we'll open the outpatient form from the transaction module. So in this form, so system populates this form now, that is the outpatient form. Now here I'll open the outpatient record. It is for patient John D'Souza, as I said earlier. So as you can see over here that already a doctor called cardiologist is assigned or appointed for this patient's treatment here. So you can see all the details of that doctor, including you can also see the prescription which is given by the patient by the doctor to this patient. Similarly, you can also capture the consulting charges of the doctor for this patient, and as well as you can mention or capture the discount for the reflection in the billing module, so that when the patient will go into the billing department, so that this reflection will take into effect at that time. If we'll move into another section called diagnosis section or diagnosis tab, you will find another subsection called referral diagnosis. Here you will find that there are a lot of referrals available here, so that you can from here you can choose that patient is coming through which referral, so that it will be recorded in the in the patient's record. So here in the bottom part you can see that there is ICD codes table given over here, that is the International Classification of Disease code. So from here you can capture or you can select the ICD code from the thousands of ICD codes which we are maintaining in this software. So these ICD codes basically used to be updated each and every year or each and every at a specific after a specific period. So it is basically coming up from the master forms in the software. So whatever ICD codes you have, you can maintain those ICD codes in the software itself. Moving to another section called admitted diagnosis. Here you can maintain other details of the patient's treatment like pulse, weight, blood pressure. Similarly, in the bottom part you can mention or capture the risk factors, like if the patient is having the habits of smoking or is alcoholic, so you can capture those details as well, so that it will be helpful for the effective treatment of the patient. Similarly, if the patient is suffering from some type of drug allergy which he's got due to the medicines prescribed by the doctor during the last treatment, so you can capture those details as well over here, so that it will be helpful for the effective treatment of the patient. So similarly, there are other features available for the diagnosis of this patient in the outpatient form, so that you can capture those details as well in this form in their respective features. Moving to another section, from here you can attach any type of documents or reports with the patient's record. Suppose here we have attached an X-ray image of this patient here, just like this, with the patient's record, so that it will be saved with the patient's record, and whenever you want to see these reports, whenever you want to print those reports, you can print it from over here. So this is basically for attaching, and it will be saved with the patient's record. So this was basically a brief overview of the different features or diagnosis features of the outpatient form. So you can see the other features in the next slide. So this was the outpatient diagnosis.